Hey guys, welcome to today's video. It's going to be about surgical audit and research. Let's get started. So the aim of surgical audit is nothing but improvement in patient experience and also innovative way of treatment and quality of care. It keeps the surgeon's brain stimulated all the time so that he is very capable of performing new innovative things, getting creative himself. How do you understand surgical audit and research? Perform your own studies. So basically, surgical audit and research is revolving around research. I'm pretty sure that many of you guys will also be starting to build up CV. So to do your own studies and find out how the audit and research works. So audit or research, first of all, the first step is to distinguish it and determine the aim of it. So to find out that, we see another word called service evaluation. Service evaluation is nothing but revalidation for individual surgeons. It is very helpful in revalidation of them. It will change as per level. It can be at the level of the team, level of the institution, level of the particular region, for example any state, or it can be national, country. The most commonly noticed ones are the institutional and the national levels. So there is this concept, it's called the audit cycle, where first we have to define our aim. Second, identify the evidence and the standard of study. Third, design how to measure whatever you are going to do. 4 is we measure. 5 is we analyze whether it is good or bad. 6, do gap analysis. Gap analysis can be seen if it reaches the standard. If it reaches the standard, you can do re-audit. And if it does not meet up the standard, we have to define it and start the audit cycle all over again. So that's about it. And then first step is to identify the research topic. We form an idea, such as the idea can be like asking a question whether this drug is helpful in treating this particular problem or not. For example, a drug A, is it helpful in treating diabetes or not? And second, form a hypothesis. Ask a question after the form a hypothesis. You say that this particular drug is going to be helpful. And third, you think, does it really matter? For example, if this research is done, will it be really helpful to us? And what does it even add on to the literature? Step 3 is to find out whatever information we can get. For example, we can get information through Google Scholar, Medline, and PubMed websites. Step 4 is discuss with other peers who have conducted research in a similar topic. You can also approach professors and surgeons, etc. Step 5 is discuss about the responsibility. For example, if you're doing a research with some person, you want to talk about the responsibility, who takes the credit, who does not take the credit, and so on. Ask a few questions to yourself, as in why the study is done, whether it is useful or not, whether it is practically feasible or not, whether it can be done with the available time, with the available resources. Money is a very commonly limiting factor. I mean, I myself had a trouble in finding adequate money to do my research, and yes, that is one of the main things. Fifth is benefit. How will this treatment benefit others? Is there any monetary benefit or effectiveness of treatment? 6, the expected findings. 7, the requirements, additional requirements if any. And 8 is ethical issues. While talking about ethical issues, it's pretty easy for us to say whether a particular study needs ethics clearance or not. It's a simple common sense that if you're involving some living organism, say a human being, taking a sample from them, it is needing ethical clearance. Okay, ethical issues. And 9 is impact. And then there are these 3 things which we have to discuss about. The terms are research, clinical audit, and service evaluation. The aim of each and everything will be seen now. So first is the aim. Aim of research is to generate and test the hypothesis, whereas for a clinical audit, we need to generate information regarding the delivery of best care. And service evaluation is information regarding judging the current care. And in the research, address we are going to address the questions, various issues, aims, and objectives. Whereas in a clinical audit, we measure. In a service evaluation also we measure, but in clinical audit we measure it against a standard, whereas service evaluation does not need a standard at all. We simply measure. For example, in clinical audit we say whether it is better than the standard or lesser than the standard. In service evaluation it's just 1 centimeter, 2 centimeters sort of numerical values only. There is no standard. Research means routinely done along with additional information. Additional investigations are the one which we are doing in the research, the investigations. Clinical audit and service evaluation will involve analyzing existing data. Existing data can be supplemented with some interview and questionnaire too, which is very easy to get from the patients. Research involves randomization, whereas clinical audit and service evaluation will not require randomization because it's not a research technically. About quantitative research, we want to test a hypothesis, identify a theme, and after that testing the hypothesis. And whereas the clinical audit and service evaluation, we are going to analyze if the service is achieved. So if it is achieving or reaching a predetermined state, it's called clinical audit, and if it is just identified as in what is the standard, it is of what standard. So we don't compare it with anything, we measure what it is doing. That is a service evaluation. And clinical research will involve new ideas, whereas clinical audit and service evaluation involves the ideas currently in use. And in research we have to allocate patients, but there is no allocation, no randomization in clinical audit and service evaluation. Qualitative research requires experience and underpin justifications too. And then moving on to various steps. The first step is project design. Project design is including both pilot and a formal project. So how this project is going to go about, we have a trial project, which is a pilot project, followed by which a formal research can be done. The project design is of two types, quantitative and qualitative. Quantitative will mainly revolve around hard and fast facts. For example, it can be seen. Quantitative is very much seen, like physical stuff, like whether the person is dead after the particular intervention, or the person is still alive, or is there a disability, or there is no disability. Quantitative, okay. Qualitative one is a narrative. It's more of a psychological impact. So we ask the patient, what do you feel the quality of care is better? So that comes under this type of project design. The important component of it is PROM, and another important thing which we need to focus on is finance. Finance is very much limited. PROM stands for patient reported outcome measures. And then is the sample size. Sample size is it's very important because the number of patients who are included in the study is also very important, because it suggests the validity of the study. So if the sample size is inadequate, the study itself is considered invalid. And there are two types of errors, false positive and false negative. These errors will not happen if the sample size is normal or effective or satisfactory. And if the sample size can be increased by doing a multi-centric trial, meaning involving patients in the nearby hospitals as well, randomization is usually done in order to prevent the bias. Usually the power is calculated with 80% cutoff, and SI, that is the significance, that is going to be with a 5% cutoff. That's the significant level. And how do we eliminate the bias? We do it by blinding. Blinding can be for double blinding, single blinding, and triple blinding, where either the patient alone or the observer, or the researcher and the observer and the patient, everyone are blinded. Study protocol will involve the aim, objectives, the background, methodology, Define the population, specifically if it's a case control study, define the population as in what is a case and what is not a case, what is a control. Population definition is very important, and of course the sample size will be noted on. Criteria, that is inclusion and exclusion criteria, is also needed. Methods of analysis of the results. Prerequisites include the fund and ethical clearance. The last one is the data collection form, which has to be stored confidentially. Effective communication is valid through internet as well. Regulatory framework is the next one, which is giving the sponsorship. It decides the responsibility as well. It is taking care of the responsibility for initiation, management, and financing of the project. And then comes the peer review. Peer review is done by a supervisor, an unrelated expert, or a funder. A peer review done by the funder will tell the funder or give information to the funder regarding your progress of the research. Ethics is very important. The guide is common sense, as we already know. Ethics application form has to be filled up and submitted to the concerned authorities, mostly to the educational institutional ones itself. IRAS is nothing but Integrated Research Administration System, which is the one which is circulating the application form for the ethical clearance. Long and detailed meeting attendings will be also there. Long and detailed forms have to be filled. Whenever you don't attend the meeting, consequences are really bad, so you have to attend the ethics meeting. Never start the research prior to the approval. However important it is, you really need ethical clearance. Regulatory approaches. Mandatory registration before publishing is needed, so you have to register yourself that you have done a certain research. And arrive guidelines is mainly for animal experiments. And research integrity is first it was given by Singapore statement. After that it was given by the European Code of Conduct. It says a few valid points, such as the trial has to be honest, accountability, and it will be very transparent, meaning everyone will know what is happening. Every study subjects will know what is happening to them. Professional courtesy and fairness. You have to treat everyone with dignity and stewardship. Statistical analysis, however, is the most difficult of all the parts of research. It is, however, the most criticized part too. Statisticians have to be consulted before starting the research because that's what they like, and they also will guide us how to do about the research. Use terms like mean mode and media and normal distribution, because these will attract, because it is very easy to understand. And then applying statistical analysis can be applied between numerical and normally distributed values, and it can be of two types of t-test, paired and unpaired t-test. If it is numerical but not normally distributed values, use u-test, which is Mann-Whitney u-test, or Wilcoxon signed rank test can also be used. Categorical values will require chi-square test. The confidence interval will be 5% and the p-value will be less than 0.05% for 0.05 for a normal research. However, there are certain cautions that cautions have to be exercised because these values are very important. The computer software packages are available. The main important benefit of using this is very quick. Analyzing a scientific article, checklist for authors has to be carried. The checklist consists of title, abstract, introduction, methods, results, and comment. The methods will include protocol, assignment, and masking. Results will include the patient follow-up, patient flow, and patient follow-up and analysis as well. And then comes quality scores. It can be Jadad score and Prisma guidelines. Presenting and publishing, the negative results have to be published too. For example, if you expected a positive result but you didn't get a positive result but you got a negative one, you still have to publish it because it will still help the other authors from deviating more towards the same topic. And appropriate forum love, we have to post whatever we want to publish. And then poster presentations are very important because they are very attractive and most of them prefer posters to presentations. Peer reviewed journals are also done. Open access journals are also there where the author has to pay for publishing. And whatever you are going to publish, this to be very detailed. And then there is this IMRAD format. IMRAD format is kind of like a methodology how you have to do it. IMRAD includes introduction, methods, results, and discussion. That is the main format. So introduction has to be short. Methods include methodology and study design. If it is new, we need to explain the entire study design. But if it is in use, for example, PCR or ELISA, we just have to tell the name. We don't have to explain it then. Results should be including diagrams such and tables and figures too, because they are easy to understand. Discussion will interpret the brain findings. Whatever findings were there, we have to interpret. It has to be done intelligently. It is not just done uh, without any aim. It has to be done intelligently. And we have to state suggestions for future studies or changes in treatment as well. References have to be up to date. References have to be from up to date articles, recent ones, not 100 years old ones. Evidence-based study aim is to find new best ways of managing patients using clinical evidence. We want to give the best possible care to each and every patient who knocks onto the hospital door. Evidence needs reviews of multiple randomized trials. It can be done by Cochrane collaboration. They are helping in evidence-based study, so go and check it out. Thanks.